So good afternoon, everyone. So today's lessons were the lessons for our pre-final term. We have here the pre-analytical considerations in phlebotomy. So pre-analytical means it includes procedures such as laboratory handling and identification which takes place prior to any laboratory testing. So, yung wala pa talaga tayo nag-process ng specimen. So, prior pa in laboratory handling natin. So, in this phase, proper control measures are placed to avoid subsequent issues. So, it starts when the doctor's order is given and ends when laboratory testing has officially commenced. So, it starts when there is a request from your doctor and it ends when you start processing it. So, that is the pre-analytical stage wherein prior pa ta process sa specimen or mag-handle sa mga chemicals, laboratory, so that is where your pre-analytical stage is. So at the end of the lesson, you should be able to enumerate the physiological variables that influence laboratory test results and identify the tests most affected by each one. Another, you should identify problem areas to avoid insight selection, give causes for concern, and describe the procedure to follow when a difficult situation occurs. Next, you have to specify the various vascular access sites and devices and illustrate what to do when they are encountered. And of course, explain how to handle patient complication associated with blood collection and spell out how to avoid or handle procedural error risk and reasons for failure to draw blood and discuss appropriate specimen quality. So along the discussion today, we will encounter about that and you at the end of the lesson, so you must be able to do that because um, we have to learn this even though we are in virtual. um, at least you have the idea, the concept of what to do in case of um, these situations. So we have the table here, the physiological variables that influence laboratory test results. So may mga changes talaga depending on the variable. So we have here age, 'di ba? So sa iba yung results or makita mo na endpoint or result sa baby ang kinunan mo ng dugo or matanda na, 'di ba? So may mga different reference range din sila. So in age, so the affected substance or the blood composition is your red blood cell, white blood cell, creatinine clearance. So creatinine clearance, this is the it measures your renal function. Okay, so altitude, so mag-differ din sa kanyang red blood cells. Usually yung mga hemoglobin, depende kasi kung nasa taas ka na lugar, so may tendency na mag-change yung RBC mo na results if ever kukunan ka ng dugo doon. Okay, because of the altitude, siguro sa oxygen level ata yan. Okay, we have here the dehydration. So if ever ang patient mo ay dehydrate, so you expect that there are changes in heme concentration, in RBC result, in enzyme, in iron, calcium, sodium, yung mga resulta. Kaya maapektuhan man siya sa pagka-dehydrate sa pasyente. So we have here diet. So there maapektuhan niya ang glucose, lipid, electrolytes na to. So diurnal variation, so it means the time na there is changes in your thyroid stimulating hormone sa imo ng thyroid. So this TSH, it gives signals to your thyroid to produce or to lessen your thyroid hormones. Okay, so we have here cortisol and iron. So in drug therapy, ano yung mga maapektuhan niya? We have here enzymes, hormones. In exercise, meron din pala. So if ever your patient grabbing exercise tapos nagpakuha ng dugo, so expect changes in this area. pH, carbon dioxide, partial pressure, the creatinine kinase, the LDH, the glucose. So later on in your third year, you can go deeper in these enzymes. Kung para saan siya. So fever, so makaapektuhan din niya yung hormones natin and the cortisol. The gender, so it affects your RBC, your red blood cells, hemoglobin, and hematocrit. As I've said earlier, sa test result mo, may mga iba't iba talagang you call that reference range ang mga iba't ibang gender. We have the female and the male. So iba-iba sila ng reference range. So we have here jaundice. So it affects yellow color interfaces due to increased bilirubin. So it affects talaga kasi interface yung yellow color because you have jaundice. Intramuscular injection. So there is changes in CK, creatinine kinase, skeletal muscle fraction of LDH. So in position. So as a medtech, dapat naka-position og tarong ang imong pasyenteng kuhaan because isa dai siya sa mga variable nga pwede mag-affect sa result nimo. We have here maapektuhan niya ang protein and even your potassium. So pregnancy din, may mga changes sa kanyang red blood cells. In smoking, so in patient nga nag-smoke, so expect changes in the cholesterol, cortisol, glucose, growth hormone, triglycerides, and your WBC. So in stress, so stress din pala, nakaka-change ng mga, nakaka-affect ng mga substance such as your white blood cell, your iron, your adenocorticotropic hormone, catecholamine, and cholesterol. So kani sila ang mga changes kung stress ka. So imagine taas yung stress. So dako jud kay changes ani nga mga parameter. So we have here temperature and humidity. So it changes or it affects your hemo concentration. So problem areas to avoid troubleshooting in the site collections. So when you perform phlebotomy, you should avoid this site or this area to avoid na mag-troubleshoot pa ka. So first, we have the burns, scars, and tattoos. So bakit di siya pwede it is not advisable to choose a site that has burn, scar, or tattoos because veins in the area may be difficult to examine and blood circulation may be impaired. So in burns, maybe too painful siya to touch, kay syempre burn. And tattoos may also be susceptible to infection due to the dyes used that may interfere in the processes. So that's why dili na to siya ginakuha ang dugo basta na yung mga presence ni burns, scars, and tattoos. We have here damaged veins. So aside from being difficult to perform, puncturing damaged veins may also produce inaccurate results. Veins could be sclerosed or hardened or thrombosed or clotted. So wait lang yan. Let's continue. So another areas to avoid if the patient has edematous part of his body, the edema. So it is an abnormal swelling caused by the accumulation of fluid in the tissues. The tissues become fragile, making the task of locating the veins harder. So pag edematous ang patient, isod siya ma-feel nimong ugat. Isod siya makita ang ugat. So this condition may be due to reaction from medications, pregnancy, infections, and other medical problems. So I have here another hematoma. So sorry guys. Avoid this area. Kung makita nimo yung patient nga nagka-hematoma na because of the previous nga blood collection niya, so don't get blood from there, okay? So what do you mean by hematoma? So it is a solid swelling or mass of blood in the tissue. It caused by the leakage of blood from the vessels during the venipunctures. Nag-leak ang dugo during venipuncture, during the previous venipuncture, kaya may hematoma. So when you select a venipuncture site with hematoma, it will be painful for the patient because it will obstruct the blood flow. So it might also lead to contamination of blood sample. Pwede na. So mastectomy. So, this is a procedure often done to breast cancer patients. So it refers to the what removal of the breast through surgery. So that this is what you call mastectomy. So blood drawing from patients who had undergone this procedure becomes a challenge, since the lymph flow is obstructed and there may be swelling and infection after the surgery. So muna disod kay siya para sa ato ang akuan siya. In addition, we have tourniquet cannot be applied because it can cause injury. So it can also change the blood composition. Kaya kung ang patient mo ay nag-undergo siya mastectomy, so ato lang sa area opposite sa asag ikuan siya boobs. Dahil sa right siya ikuan boobs. Then sa left arm ka pwede magkuha. Okay? You can see in the picture, sa arm niya dapit nga tanggalan siya og tutoy ng hubag, medyo nidako. Okay? Whereas sa isa, medyo normal. Another, obesity. So that is very most common yung mga encounter during phlebotomy ka because daghang mga pasyente nga mga tambok. Dili sa obese, na po ibang overweight, dagko na yun kay food sila, pero pa sila obese. Can be overweight pa. Lisod na na sila kuan, how much more ang mga obese na mga tao. So they are grossly overweight na. So these obese people or person, deep na kay na ang ilahang vein and it is hard for us to locate it. So the solution is using a longer tourniquet or locating the cephalic or cubital vein. So sa kilid-kilid na lang. Ilawom na ay na yung ugat o natabunan na sa fats. So let's move on. So vascular access sites. When we say vascular access sites, it is a direct method wherein maka-help siya para mas madali ang tanggal sa substance or pag-entry sa medication depending sa process nga itubuhat ani. So vascular access sites. We have here arterial line. So in vascular access sites, so there are cases when these vascular access devices are needed for blood sampling, infusing medication, central venous pressure readings, and blood transfusion of a patient. So usually kanimo ani trabaho ni sa nurse. So dili ni sa medtech. Pero let's just discuss this para na may idea. So choosing vascular access sites is based on the needs of the patient. The purpose and the length of time the device is to remain in the body. So it is a device. Okay. So we have here the vascular access sites and devices used in the phlebotomy. We have here first arterial line. So to obtain samples for arterial blood gas and laboratory studies, so critically ill patients require arterial lines where a thin catheter is inserted into an artery. So in the picture we have here a thin catheter inserted into an artery. So this is also used to monitor blood pressure continuously. Neither tourniquet nor venipuncture is allowed in the arm with an arterial line. So, dili pwede butang tourniquet or mag-perform kag venipuncture dira. We have arteriovenous shunt or fistula. So, passageway, it is a passageway created through surgery. So, it has the intention of connecting the artery and vein directly. So, para ni sa mga nag-hemodialysis ng mga patient or kaya katong nagka-process silang erosion of arterial aneurysm. Deep na dyan siya. We have here blood sampling device. So, it is used to avoid the use of needles or stick, prevent infection and reduce wastage from line draws. So, the device collects blood from the arterial or central venous catheter where it is connected. So, another vascular access sites, we have heparin or saline lock. So, the most common kanang hep lock. So, it is an IV catheter attached to a stopcock or cup with diaphragm. So, basic function niya is to provide access for administering medicine or drawing blood from the patient. So, kung naamoy mga pasyente, usually ako nabantayan ng mga baby before sila discharge from the hospital na yung mga usahay, mga hep lock. So, makauli lagi sila pero by time to time na ay mga time na dapat maadto sila sa hospital then magpaturok sila og tambal. Iagi siya sa hep lock. So another, we have IV sites. So an IV line, is a thick plastic tube or catheter inserted into the vein in the forearm to inject a volume of fluids into the bloodstream. So muna ang pinaka-common kanang mga madextrose, magpa-IV. Or kaya, magpagluta. So, IV sites yapon. So, you inject a volume of fluids into the bloodstream. So, the phlebotomy should avoid collecting blood from the arm with IV because the blood collected could be contaminated with IV fluid. So, on my past discussion, sabi ako sa inyo na hindi magkuha ng dugo sa may part na naka-IV kasi dili siya advisable because maybe ang imong fluid nga makuha is contaminated na with IV fluid. Imbis nga ang result is baba kay siyang mga electrolytes. Dito man ka nagkuha sa IV dapit, so basi kato imong makuanan and then man-normalize ang iyang electrolytes which is multisulod sa IV. Okay, so dapat take note that. So we have here another, last one, the central vascular access devices or the CVADs. We have central venous catheter, implanted port, and peripheral inserted central catheter. So it is called indwelling lines. So it is any of the tubings inserted to the main vein or artery used for blood collection, monitoring the patient pressures, and administering medication and fluids. So, na-siya 3 types. Ito central venous catheter. We have in central venous catheter, also known as central line inserted into the large vein and advanced into the superior vena cava. So, in implanted port, it is a surgically implanted disc-shaped chamber attached to the indwelling line. This is usually placed in the upper chest just below the collarbone. So, disc-shaped siya nga chamber. I-implanted siya dito sa may upper chest below sa imuhang collarbone. So, and last one, the peripherally inserted central catheter. Is a flexible tube inserted into the veins of extremities and the central veins. So, gina-insert po siya. So, let's move on. So, handling patient complication associated with blood collection. So, as a med tech, so nag-start ka blood collection, So what if may mga complication associated with your blood collection? We have here example allergies to equipment and supplies. So may mga pasyente nga allergy sa mga tourniquet, sa mga alcohol, kaya sa imuhang gigamit nga ano ba gauze kaya sa imuhang gloves. So when the patient has adhesive allergy, so a gauze should be placed over the site and should be removed after 15 minutes. So alternative ana is ingnan ng pasyente nga i-apply pressure for 5 minutes. So when the patient has antiseptic allergy, simply use a different antiseptic. So when the patient has latex allergy, look for signs to indicate the allergy and use a non-latex alternative for gloves, tourniquet, and bandages. So ngita na lang kag alternative. Next, excessive bleeding. So it is one of the complications associated with your blood collection. So if ever ang patient is on aspirin, on anticoagulant siya, ang bleeding, usually dugay na siya mahunong. So dapat tingnan mo siya nga ang pressure imo pa siyang padayon until nga magkita nila nga mag-stop ng bleeding. So another one, fainting. Syempre normal na ni mga taong mahadlokan jud kuhag dugo, kuyapan jud sila. So you should take note of that. Nga may mga taong makuyapan jud. So when your patient has already fainted, so pahigdaon na lang sa sila during the venipuncture. Okay, stop sa inyong venipuncture. Okay, so kung mauli-ulian na sila, so pwede nimo sila pahigdaon lang tapos you perform venipuncture. So nausea and vomiting sa mga pasyente nga kasukaon, malipong during blood collection. So discontinue sa muna until the patient feels better or until the feeling subsides. So another pain. So di yun na mawala ng pain. So dapat inanimudaan nga medyo sakit ni siya. Tapos kung feeling yun niya na masakitan siya maayo, paningkamutan ni mo 1 shot lang. Okay? Mabili ka mag-probe, mag-redirect sa imong needle. Another one is your petechiae. So there are appearance of small red or purple spots that look like rashes, which appear on the arm when tourniquet is applied. So wait lang. So mga small rashes na mag-appear when i-applyan ni mo tourniquet.